All righty, we're going to go ahead and get started. We might have some more friends join us here shortly. So, my name is Matt Point. Welcome to Children with Diabetes, Friends for Life Fall 2021. Tonight is our psychosocial focused evening. My name is Matt Point, and I am the Director of Advancement here at Children with Diabetes. I'm one of 5 full-time staff members, and we are so excited to have you join us tonight. Just as a friendly reminder, there is a Q&A box at the bottom of the screen, as well as a chat feature. I'm going to invite you to drop any questions you have in the chat during the presentation tonight. And at the end, I'm going to pop back up and we will answer all of your questions that you have. So feel free to drop them in the chat or in the Q&A, just so you know, if you have a bit more of a private question, or you don't want, if you'd like it to be asked anonymously, you can send the question directly to me, Matt Point, in the chat, or you can post it anonymously in the Q&A, and I will make sure that it gets asked at the end. So tonight, I have the pleasure of introducing our speaker for the next session, Julie Gettings. Julie is a clinical psychologist within the Division of Endocrinology and Diabetes at the Children's Hospital of Philadelphia. Dr. Gettings works with youth and their families on improving adherence to diabetes management tasks, coping with chronic illness, improving family functioning surrounding illness management, and treating symptoms of mental health disorders. Prior to her current position, Dr. Gettings was the diabetes psychologist at Children's Hospital of Pittsburgh and served in a similar role. Dr. Gettings is involved in clinical research with a particular focus on mental health screening for youth with chronic illness. All righty, I think that's it. Thanks for joining us tonight.
Thanks, Matt. I appreciate the introduction, and thank you everyone for being here. I know everyone has a lot of things they could be doing, and I appreciate you spending the time with me here today. So hopefully we can go through some things that may be helpful for you, your person with diabetes, your child, whoever it may be. I will tell you, I'm used to working with young people and parents, so please forgive me in advance if I reference them. But my hope is that this talk can be helpful for really anyone at any age with diabetes or the people who care for them. So let's talk. Today's goals. Just want to give a brief background about the topic for today. So the topic is really sharing data and remote monitoring of continuous glucose monitors. So we'll review that first, and then I want to get into some tips for navigating the use of remote monitoring and data sharing. We'll review the main points, and then I'll leave time at the end for questions. All right, so continuous glucose monitors have been around for a while now. And so just as a brief overview, if you're not familiar, I know most people probably are, but this is usually a device that's inserted or in some cases implanted in or on the skin that allows for almost real-time data collection of people's blood sugars. On the whole, they're shown to be really helpful in terms of reducing diabetes distress, lowering A1C, improving medical outcomes, quality of life, especially for folks who use them regularly. Now, with all these benefits in mind, there are also some downsides of continuously having access to blood sugar numbers, whether they're your own or whether they're someone else's. And so, as I said, today we're going to focus on really remote monitoring and how to negotiate that really challenge that can be there in sharing your data with someone, and then that person also having access to the data. There was an interesting study in the past year that really reviewed how remote monitoring can promote independence and can be helpful, especially for young people with diabetes whose parents or caregivers want to monitor them. Although this study points out clear boundaries are really necessary to prevent parental over-involvement, as in this study, but really, I would say clear boundaries are important for any relationship in general, but especially as it has to do with remote monitoring. So with that in mind, this slide here is based on really my clinical experience in working with young people with diabetes for, let's see, over about 10 years now. I've noticed that for families who, have someone with diabetes, it's really a balance. And it's trying to find some balance between the person with diabetes being annoyed the least and the person who cares for them, whether that's a parent, caregiver, partner, minimizing their anxiety about it. One of the most common things I hear from young people with diabetes is, this is so annoying. I don't want to have to do this. They're so annoying. Why do they keep asking me all the time? Why do these alerts keep going off? It's so annoying. Now, keep in mind, this is not the only emotion that comes up. There's a whole mix of them. But as we think about remote monitoring using CGMs, it's really finding that balance for you, for a caregiver, a partner, a spouse, so that everyone can feel comfortable with how things are going. All right, so let's go through some tips. And I should say this is based mainly on my clinical experience. Many of the suggestions are rooted in research and data as well. And so some things to keep in mind. Tip number one, I broke it down to 6 tips just to give you a heads up of what's coming. So the first thing is know the person with diabetes, whether this is yourself, whether this is your loved one. We have to keep in mind all the factors that go into how they monitor their blood sugar and how they communicate and how you can partner together. So this includes how old they are, making sure the expectations you have for the person's communication and diabetes care is really age appropriate, right? So this would be, for young children, for tweens, still providing some supervision as they transition to adolescence and adulthood. Also, their age at diagnosis. Is this a new thing for them? Are they 17 doing a lot of 17-year-old developmentally normative things, right? Pulling in developmental level, although they've only had diabetes for maybe a couple months, and maybe they're not developmentally at the point where they are in terms of their age for being able to take on certain responsibilities. So age, developmental level, diabetes developmental level, right? In terms of their, again, knowing where they are in terms of how long they've been diagnosed, how accepting they are in the diagnosis, how much initiative they're ready and willing to take in terms of the tasks. Their communication style, right? As we talk about communicating with, our loved ones, our person with diabetes, how do they prefer to communicate? Is this through conversations? Is this through text? Is this through emojis? Is this through mail? Probably not. But you get the idea. You have to understand what works for them, right? So this is about the person with diabetes who's wearing the continuous glucose monitor. So it's important to really put them first and knowing how to communicate with them as kind of a primary goal here. And then finally, as we think about ways to, help promote healthy communication and putting effort into diabetes tasks, it may help to know what motivates them. In a moment, we'll talk about potentially rewarding certain behaviors, certainly not all, but keeping in mind things that motivate our loved ones can be helpful. All right. So my next tip for making this successful for yourself, if you have diabetes, or for your loved one, is to know your technology, right? So with continuous glucose monitors and really any technology, they're constantly evolving in terms of what they can do, how they can do it, how quickly they can do it. So, I recommend that all parties involved know how the device works. And this includes, how to put it on, how to take it off, what settings there are, how often is the data refreshed, how do you get data, what are some reasons you don't receive data, right? If it's not always because the person turned off their data, maybe they have, they're laying on it a certain way, or it wasn't inserted properly, or who knows what. So knowing all the functions, knowing all the alert settings, right? Really key. Keeping in mind that, you know, if you're the person with diabetes, you might want to set your alerts at a certain frequency or blood sugar level, and your loved one might want to set them at a different level, right? In order to assist with working together and communication. It's really important that you know what's available and how you can do that. And then finally, keeping in mind the limitations of the device. Again, things like how long does it take for changes to come up, or you know, how certain alerts work or don't work, or certain ratios or space you need to be in order to get the data, or certain Wi-Fi, whatever the case may be. So really knowing this technology is key to knowing how to work together most effectively, avoiding assumptions, and really making that remote monitoring actually helpful. All right, let's keep going. So I hope everyone appreciates my use of clip art here. My next tip is really to keep your cool. And this is probably helpful for any conversations around diabetes as you work with your diabetes team. And with that, I mean, you know, diabetes is essentially a team sport. We all know this, that it's helpful to have a whole host of people help you, support you. And so it's important as we think about remote monitoring, if you're the person with diabetes or you're the loved one, having conversations based on the actual data that you're seeing. This includes, you know, avoiding judgmental comments of, oh, you know, I saw your data, it looked like your numbers were good all day. Looked like your numbers were bad all day. It just has kind of a judgmental tone, right? And so, you know, part of healthy communication is being able to say things like, hey, I noticed your numbers were in range most of the day. Great job. What was going on? How'd you do that? That was really cool. Or I noticed you were above range, you know, in the evening. What was going on? Right? So it's usually helpful to lead with presuming innocence, and, you know, getting the story of what's going on rather than assuming something happened, or you were eating, or what did you do? You turn the data off. Generally not helpful, right? So having the conversations based on the actual data. Now, another point I want to just point out here, just putting my psychologist hat on, is just taking a minute to talk about emotion regulation. So this is, I mean, essentially the fancy way of saying being able to manage your own feelings in a healthy way. So of course, when you see your own data, when other people see your CGM data, a ton of different emotions can come out. It could be anxiety, frustration, guilt, sadness. I mean, there's a whole host of things. Just in general, keeping in mind the principle that when your emotions are intense, whether they're positive or negative, mostly in this case it's negative, as those negative emotions become more intense, your rational thoughts inversely decrease, right? So what I mean is, if you're feeling really emotional, you're not going to be thinking your clearest or most rational thoughts at that point. So what can be helpful is really finding a way to either calm yourself, take a break. You know, if you see a number and it provokes a really strong emotion, might not be the best time to just, you know, communicate that out. Maybe you need to take a few deep breaths. Maybe you need to take a break, a walk, and then be able to communicate when your thoughts are a little clearer. So choosing that short-term strategy, also, you know, just probably good practice in general is if, you know, you need help with more longer-term emotion regulation, thinking about things like meditation or whatever can be calming to you to help in terms of keeping your cool in general, and especially as we talk about our situation here. Another thing to think about is, and this is especially for our caregivers or loved ones, is how we act affects how others act towards us. So this idea of modeling. So I talk to parents a lot about this in general, that, if we're looking at numbers and reacting strongly or getting angry or, reacting in an unhealthy way, our children, our loved ones, they see that. In some ways, it makes them think it's okay to act that way. So they might be reacting strongly towards you, right? And so it's really a friendly reminder that this is really stressful, to have your blood sugars monitored consistently throughout the day, not just for the person with diabetes to see that, and sometimes that brings up their own feelings, but for to know that someone else is watching you can also be very stressful in its own right. So my friendly considerations are, as a loved one, how are you doing with your health behaviors, with your emotions, with how you communicate? How do you react when people are monitoring you, right? What would that be like for you, whether you have diabetes or not, if someone was constantly seeing what you were doing, what you were eating, making assumptions of how active you were, what you were doing, not doing, and then making, having commentary about that throughout the day. So just a little perspective to keep in mind for everyone. All right, so next up, make a plan. So this is really key in terms of having effective work together in terms of data sharing, remote monitoring. There need to be really clear expectations for the person with diabetes and clear expectations for the loved one or caregiver. Now, I can't sit here and tell you a plan that's going to work for everyone. That's impossible, because I certainly don't know each person or their specific qualities, their developmental level, things that are important to you, morals, values. But what I would encourage you to do is think about yourself. Think about your loved one. Think about how we can best have that balance between feeling the least amount annoyed and feeling the least amount anxious. So with this plan, we need those clear expectations, and we need a plan for follow-up. How are you going to check in to make sure those expectations are met? In some cases, you may find that it's useful to use rewards or positive reinforcement. And I'll give you an example of a time where I think that might be applicable. Oops. All right, so let's talk about an example, something that would come up commonly for me. And, again, just an example, probably could relate to others as well. But let's think about John, who's a 15-year-old with type 1 diabetes, who's out at a friend's house. He shares his CGM data with his mother, father, and paternal grandmother. He's kind of mixed about the CGM. He knows it's helpful, although he doesn't love wearing it. He gets annoyed when he receives the CGM alerts. And not only does he get the alerts, but he gets frequent texts and calls from his parents and grandmother when they notice any fluctuations in his blood sugar numbers. All right, so let me give you an example of a plan with the asterisk of, again, my disclaimer, this may or may not, work for you, but just some ideas. So as a caregiver, it's perfectly reasonable for you to make part of the plan. In order to leave the house, John's phone must be on and charged to a certain percentage, 100%, 80%, 90%, whatever you feel comfortable with, right? So making that part of the expectation in order to leave the house and do something socially without a caregiver. You might also want to set the expectation that if John receives a low alert, he texts to a parent group text message within a certain time frame, right? So a couple things here. One, we're trying to minimize communication for him. He's already kind of annoyed with all the alerts and communications. So ideally, a group text could be helpful with that. So given that his parents are his primary caregivers, it would be with them, okay? And the group text is helpful because even if one parent's not available, again, they know that the communication happened. If the caregiver does not hear from John after a certain time frame, the parent will text John via the group text. Okay, so in this plan, the first initiative is on John. If he gets a low alert, he has to communicate with the parents. If they don't hear from him, then that gives them the chance to reach out. All right, so just more expectations. And I promise it doesn't have to be this involved every time, and most families just get used to this system. I'm just laying it out in pretty specific detail, so please bear with me. So the idea is then after John gets a text, John is expected to respond within a certain time frame. If John does not respond, the parent will, and this is your opportunity to add certain levels of responses. So this might be the parent will then call John, or a parent will then call John's friend, or a parent will then call John's friend's caregiver. And then maybe the next step is the parent goes to the friend's house. We really need to flesh this out, you know, so it's clear and it doesn't seem so haphazard of how, you know, everyone's trying to communicate. Another thing that I think is important to point out here is that just because you're sharing the data with grandmother or someone doesn't mean that it gives them permission to contact the person with diabetes or for grandma to contact John all the time. So in this example, we're putting the parents as primary. And one idea is that the grandmother can communicate with either mom or dad if she receives the alerts and ask, is John okay? Do you need anything? Can I do anything? Certainly there can be a contingency there. If she doesn't hear back, then she can reach out to John. But just some ideas in terms of different expectations that can be clear to set out ahead of time. Now, I made a mention of things to possibly reward. It's totally up to you. I mean, some families are very clear that things are just expected, and I totally agree with that. I mean, you know, things like chores or hygiene or, you know, whatever the case may be, they're just expected. In this example, a reasonable expectation is just the expectation that some communication occurs about blood sugar, right? And if that doesn't happen, then maybe there's certain consequences that a family can put in place. But it's reasonable to say it's expected that if your blood sugar is out of range, we want some communication about it. Something that could be subject to reward is responding within a certain time frame, right? It's really rewarding the effort of doing something kind of over and above, right? So if you, John, if you get the notification and within that first minute you send us a thumbs up text, that's great. You know, you get to stay out another 30 minutes or whatever the case may be. Maybe it's not something, maybe it's not a specific reward. Positive reinforcement still includes things like praise or encouragement or thank you so much for letting me know right away, things like that. All right, so another example scenario. This is with Aisha. She's an adult, 30-year-old female with type 1. She shares data with her partner. She gets her low alerts immediately, and her partner is alerted if Aisha continues to be low after 20 minutes. So this is a nice example of kind of staggered alerts, and this can be helpful for some families. In this case, some ideas. If receiving a low alert, the partner will text Aisha. Aisha will respond. That's the expectation. If the partner doesn't hear from her after let's say 5 minutes, the partner will call or maybe call a friend at her workplace or wherever she is And then making the expectation, it's not just for lows, obviously, it could be for highs. So if the partner notices high blood sugars occurring over, I don't know, 2 or 3 hours, 4 hours, whatever time frame they agree upon, making it okay to check in with Aisha. Now for adults, this is a little different, right? When this is your partner, when this is your spouse, spouses are coming from a loving, caring place, with parents or caregivers of children often coming from a loving, caring place also, with the additional responsibility of, the care of that young person with diabetes, and knowing that ultimately the caregiver is responsible. So obviously a different dynamic, whether this is a child, a young person, an adolescent you're caring for versus an adult. Regardless of that, making a plan and clear expectations can be really helpful to set ahead of time. All right, so just a word for what doesn't work. I'm sure many people watching could probably, give this part of the talk if you've ever had some challenges with the CGM or communication about remote monitoring. As the loved one of someone with diabetes, we don't want to yell, we don't want to ridicule, we're not taking attention away. I'm not going to ignore the person because their blood sugars were high or they didn't communicate. It's just not healthy. It doesn't work. Scare tactics. I hear this a lot with young people. Caregivers will come in and say like, oh, I've been watching their numbers. They've been over 400 for so long. We need to show them pictures of people with these diabetes complications, or we need to take them there so they get it. Not helpful. It actually just ends up making people feel worse. And then finally, a throwback to Charlie Brown. I'm going to save everyone from this tactic, which is just lecturing, right? If people's blood sugars are running high, and as the person monitoring remotely, they see they're running high, or the person with diabetes isn't communicating, just going through how important this is, and they need to know why this matters and why I'm so upset and why. Sorry to say, it's generally not a helpful strategy, right? It's really having that more collaborative communication, making those plans, talking together, that can be more helpful. Another thing to keep in mind that doesn't work, getting back to the psychology of it, I want to introduce the idea of negative reinforcement. Essentially what this means is that a behavior will occur due to stopping or removing something negative happening. So let me give you an example. Common example of this is an alarm clock. Now, the behavior we want to see is for people to get out of bed. And so the alarm clock is so loud and annoying that the idea is that it's going to get me out of bed. Same goes with diabetes reminders. The idea is that if we just give the reminder, the person with diabetes is just going to take action, right? Sounds simple enough. Now, if you use an alarm clock, you know as well as I do how this pattern actually goes. So alarm clock goes off, it's loud, snooze, snooze. Alarm clock plus yelling from maybe a parent, loved one, caregiver, person gets out of bed. Same goes with diabetes reminders. If you give a reminder, if you check in, you say, hey, can you, treat your low, snooze, right? The person with diabetes might not be available, or maybe they see it but can't, respond at that moment. The loved one responds again, hey, I didn't hear back. Maybe they call this time. Maybe they call again and it's more forceful and there's yelling. And then, the whole cavalry gets thrown out at them, right? There's calls, there's texts, there's telegrams, there's, everything to try to get in contact. And then finally, the person with diabetes says, okay, yeah, I got it. And so it develops this habit where sometimes loved ones feel like they need to escalate to this level to get the information that they're looking for. And so, again, we get back to that balance, right? This doesn't happen for everyone. I'm just putting out, obviously, as a precaution, but finding that balance between anxiety and annoyance, right? And developing healthy communication and plans to try to mitigate or reduce that. All right, moving right along. Step 5, continuing to revisit the plan. Just because you make a plan in one situation does not mean it's going to work for everything. This requires constant communication and revision of the plan based on what's going on with yourself, if you have diabetes, your loved one. Is the person with diabetes showing you more responsibility? Is it fair to give them more time to respond? Is that something different with the caregiver? Are they particularly stressed or need more reassurance? And then it's up to you to kind of negotiate that and have that conversation. Are family members changing? You know, are caregivers changing? So should someone else be added to the remote monitoring plan? So I wish I could say this was one of those kind of set it and forget it things and minimize all the things you need to think about having diabetes or being a loved one. This requires constant revision and monitoring and communication and finding that balance. One thing in particular I point out is really working on that constant reconsidering of the alerts, when they're occurring, who receives them. Does it make sense to set up more of kind of that delayed plan where maybe the person with diabetes gets them first and then they get a chance to respond? And then, you know, the caregiver or loved one has a delayed alert. It's really finding that balance as age development, diabetes development really progresses. All right, my last tip here is knowing when to ask for help. This can all be just a lot, right? And geez, thinking about everything, the past year, 2 years, everyone is, you know, kind of pushed to their max these days and finding it hard to manage everything at times. And that's totally normal. I think part of being successful here is knowing when you need some more help. Is it help with the actual device? Is it help from psychology or a psychosocial provider? Do you need to ask for help from an educator? I want to give a shout out for my buddy Ken Rodenheiser. I gave him a call earlier today to run things by him, to ask for help, to fact check, knowing we're all part of a team, right? If you're involved with this group with children with diabetes, I mean, there's always people here who are wonderful resources, wonderful friends. I think that got cut off. It was supposed to be children with diabetes friends, friends for life, I should say. And then other diabuddies, right? So anyone else with diabetes who kind of gets it, or maybe you asked, how did this work for you? Any ideas? What worked? What didn't work? So knowing, again, that this is a team sport and everyone kind of has their limits at times, and it's perfectly reasonable and in fact normal to ask for help. So moving right along, I just wanted to bring up a few common challenges that come up often in my practice, and then we will have some time for questions. So as we think about remote monitoring, one thing that comes up is that maybe the person with diabetes doesn't want to wear the CGM. Maybe they're annoyed with the alerts, the reminders. Maybe they're embarrassed about the device. There could be a whole host of reasons. And so what do we do in these situations? Well, probably where to start is figuring out the reason they don't want to wear the CGM. Is it because of the alerts? Is it that they can be changed in some way? Is it that you stagger them or delay them in a way that everyone's comfortable with? Is it that they just need a break right? And that's something to communicate and discuss with your family, your loved one. It can be a lot sometimes. CGMs may not be for everyone. They might not be for everyone all the time, you know? And so realizing that there's choice here and that there's communication that's important to know how to best help. Is it diabetes distress? Are they just kind of burned out? Are they embarrassed about it? And really, maybe that's the key issue that needs more attention. So trying to figure that out, again, part of healthy communication. Here's another one that comes up, oversharing of data. Maybe too many people have access. You know, there's families that come in that say, you know, both my parents have it, my neighbor, the school nurse, my friend's mom, you know, and sometimes it can just be too much, right? And so really in these situations, what to do is figuring out who needs to know and when, right? And so if you're at a friend's house, yes, then it makes sense for that parent to have access during that time period. But maybe that parent doesn't need it all the time, or this person or friend, maybe when you go to visit them, that's helpful, but not necessarily all the time. So again, negotiating that as well. Another thing that can come up is the caregiver or loved one having anxiety about the numbers. And so I call this continuous monitoring of the continuous monitor. See what I did there? It's a person, loved one, family member who is constantly looking at the watch if it's there, or on the phone. There's families who, you know, maybe a parent has it up like all the time as they're working. Probably not a healthy practice. And what becomes even a little more strained or stressful for the relationship is when that leads to frequent check-ins with the child or partner with diabetes. So this is an opportunity in terms of what do you do. It's really, again, setting those clear expectations. It's one thing if, let's say, a parent or loved one wants to look at the data all the time. Okay, maybe that person needs to find an outlet to help manage some of their anxiety, whether it's perspective taking with other loved ones with diabetes. Maybe they, you know, generally have anxiety and need more help with that. Maybe it's specific to diabetes management and need help with that. This is all to say that, you know, it's certainly okay. You know, it's understandable why loved ones or caregivers might monitor things closely. It's having that conversation with the child and partner about what's really reasonable in terms of how much to communicate about it. Is it reasonable, with the exception of emergencies, to have one check-in point while they're at school, or one check-in point in the afternoon and one in the evening, or something like that? Just having, again, clear expectations. Last one, and this is really important for young people, that along with, you know, some of the caregiver monitoring can come along with this frequent communication of caregivers who might check in with a person with diabetes frequently throughout the day. As numbers go up, as numbers go down, somewhat normally, right? You know, after meals, for example, or snacks, we expect the numbers to go up. And so where problems can arise is when people who are remotely monitoring really don't account for these normal fluctuations in blood sugars, and might reach out or might have a certain reaction, or a suggestion, or please treat, or did you do this, or did you do that? And so not only can that, you know, lead to this communication that might be more than needed, in some ways it can get in the way of a child or person's own diabetes related problem solving, right? And get in the way of their emerging independence as young people, or even adults, I should say, you know, develop in their diabetes journey. So what do you do? I mean, I think, again, it's communicating about how often is reasonable to check in about diabetes. It's communicating about when are normal fluctuations in blood sugars happening, and how long should people wait before responding if they're monitoring remotely. And also, in a very developmentally appropriate way, giving the person with diabetes a chance to problem solve and take the initiative of reaching out to their loved one about, hey, I think I should do this. What do you think? Until, everyone's comfortable that both parties are at a point where the person with diabetes can do things fairly independently and maybe doesn't need to check in. All right, so some take-home points here. Families often benefit from finding that balance between annoyance and anxiety. Knowing the technology, communicating in a healthy way, and having those clear expectations and plans are really key to having the process go smoothly. Beware of some traps you might fall into here, including these negative reinforcement loops, right? That all those reminders and escalating reminders, lecturing, punishments, not helpful. And instead, it's teaming up together, right? Both a person with diabetes and their loved one leading with a compassionate, empowering, really collaborative attitude is the best way for this to be successful. All right, so I want to thank everyone for your attention. I want to leave some time for questions at this point.
Thanks, Julie. All right, at this time, if you have any questions, you can pop them into the chat. You can pop them into the Q&A. Just to comment on something that Julie brought up was having a plan, and we have a plan in our household. I wait until I get the third notification and don't receive a text before I ever say anything. Having that agreement in place prior to anything happening has always been a great way of staving off arguments that were, could have been avoided by saying I've eaten already. So thanks for bringing that up. Does anybody have any questions? Let's see here. At what point age/maturity does remote monitoring become counterproductive and more about parental fears and anxieties than really protecting the child? Do you have a recommendation for an age or when remote monitoring is probably no longer necessary or should maybe go away?
Well, it's really, I think, unique to the circumstances. I think, again, I don't have data for this, but I think a good predictor, a couple things. One is, how just generally the person with diabetes is functioning in terms of being able to manage responsibilities. And I think as the diabetes developmental level progresses, right, as people get more comfortable with diabetes, really demonstrating with a parent in this example that that person can take responsibility even without parental reminders. And so it's negotiating plans like that. Like, for example, being able to say to your parents, if I can demonstrate to you that I can, manage my diabetes without your reminders, for this period, I'm going to ask that you X, whether it's waiting until the third notification to reach out, whether it's stop sharing at that point, and maybe you decide to share with someone else, or maybe you don't share with anyone. But I think this is something that, again, you can negotiate within your family and make a plan about, just like any other situation.
Thank you. Do you have any recommendations for how to have a conversation with a family member who is hesitant to follow someone because they're, maybe it's a parent who said, that's for your mom to deal with, or that's for your dad to deal with. It worries me too much. Do you have any advice for how to discuss those issues within the household?
I would just go in with a curious attitude. I would want to know kind of what what worries you so much? You know, what do you think is the worst that could happen? What, you know, what things could we do to help you feel better about this? Or, you know, anything to relieve that, that's really realistic. If you can't come to a compromise, I mean, that might not be the person that you want to work with, and that's okay. Maybe it's a friend or another family member or someone else. But again, I think it's just understanding the why of it and then trying to problem solve from there.
Got it. Thank you. Are there any other questions? You can pop them into the chat. You can throw them into the Q&A. We'd be happy to ask them. Let's see if there's any others that have popped up. I think that's it for now. Do you have any last words of wisdom for us tonight?
Make a plan, be kind, communicate. Otherwise, I'm just pleased to be here. Thank you for taking the time to be here with me. Hopefully there was something helpful that you can take and share for yourself or your family or your loved one. That's it for me. Thank you, Matt.
Thank you so much for being here. Thank you everyone for joining us tonight. We have our next session coming up soon. And just a reminder, a friendly reminder, if you didn't know, this is the last week of our fall fundraising campaign, 100 Years of Us, which celebrates and recognizes the 100th anniversary of the discovery of insulin. We had a very generous donor reach out to us, and we've received a challenge to receive 100 donations of at least $25 this week. And if we meet that challenge, they will give us $25,000. So if you'd like to help us meet that challenge, please go to cwd.is/100 challenge and make your $25 donation to count towards the 100 total that we need. So thank you so much. If you have any other questions or you need anything, please feel free to reach out to us at info@childrenwithdiabetes.com, and we'll see you in about 13-14 minutes in the next session. Thank you. Thanks again, Julie.